Welcome to the Addiction and Co-occurring Disorders Treatment Manual video series. In this video, we're going to be discussing setting SMART goals. We've talked about enhancing motivation. We've talked about stages of readiness for change. Now let's talk about the importance of setting goals and how to set SMART goals and prevent any pitfalls in goal setting. Treatment planning is essentially goal setting, and it's going to be important for you to learn how to set goals for your life and for behavior change and set them in a way that is meaningful and that will help you instead of make you feel frustrated. Goal setting is an integral part of behavior change. It's something we do every day. You may have gotten up this morning and had the goal of going to work or going to the gym. It was a simple goal, but it was a goal. Ineffective goals can have a negative impact on your self-esteem. It's one of the reasons that New Year's resolutions tend to be one of the worst things that you can do, because a lot of people don't set good goals. They don't set SMART goals for New Year's resolutions, and then they don't achieve their goals, and then they feel powerless or frustrated or angry at themselves. Ineffective goals can make people mistakenly think they are helpless to change anything. So let's talk about what effective goals look like. Start out by writing down instructions for how to do laundry. Imagine you're trying to teach a child how to do laundry, and you're going to give them these instructions so they know how to do it. Once you've written those down, think about how complete your instructions were. Actually go through the process of doing your laundry and make sure that everything was on the list. Most likely, you left out a step here or there, like where to put the fabric softener versus where to put the detergent. Did you remember to sort the clothes? Did you remember to look at tags for care instructions? Did you explain in the instructions how to choose which temperature, how much detergent to use, and how to handle stains and heavily soiled laundry? All of these things are important to knowing how to do laundry and how to do it well. Doing laundry obviously is not a recovery goal for most people, but setting recovery goals and any goals in life are very similar to writing out instructions. Setting goals are a goal is somewhere you want to get, and you need a plan or instructions for how to get there. Let's start at the beginning. What are you going to do, and why are you going to do it? Goals are the overarching reason a person begins to do something. In this case, for this video series, you're wanting to achieve recovery from mental health or addictions, or mental illness or addictions, or some sort of physical problem. Okay, so you want to find recovery. Often goals are broad and abstract, such as I want to be healthier, I want to be happy, I want to get sober. Okay, that's great. That gives us a starting point. Identify why you want to make that change. What are the physical, affective, cognitive, environmental, and relational or interpersonal reasons that you want to make that change? Go back to all those types of motivation. Phrase your goals in terms of adding a positive instead of removing a negative. Instead of, I want to stop using alcohol. Okay, well, if you stop using alcohol, what are you going to do instead? So you may say, I want to get clean, or I want to be happy, or I want to be more relaxed so that I can have a rich and meaningful life. Instead of measuring how sad you feel each day, measure how happy you feel each day, because you want to see that scale going up. It's semantic, I know, but it actually does make a difference in terms of helping you maintain your motivation. Once you've identified what you want to do in general, such as get sober or be happy, describe how you will know as when you have achieved your goal. And I use the phrase as evidenced by. I will know that I have gotten happy, achieved happiness, that I have gotten sober as evidenced by. This is what it will look like when I have achieved my goal. So anybody can look at that description and go, okay, have these 5 things happened? And if so, then score, you've achieved your goal. You want to make it something that the average person could pick up and say yes or no, you did or did not achieve your goal. So let's just apply this part real quick. Think about one goal you have. Why is it important to you? And how will you know when you've achieved your goal? And it could be something small. Like one goal I have is to start getting adequate quality sleep every night. It's important because it will help me regulate my circadian rhythms. It will help me focus more, and it will help me be in a better mood. How will I know when I've achieved my goal? Because according to my fitness tracker, I will get at least 1.5 hours of deep sleep every night and at least 7 hours of total sleep every night. See, all of those are very observable, very measurable things. So when I get to that point, I can say, hey, I'm doing that. SMART goals. And SMART stands for specific, like we just talked about, measurable, achievable, realistic, and relevant, and time limited. And we're going to talk about what each one of those things looks like now. So specific, look at your overall goal for treatment. For example, the problem. If you're depressed, you're saying, okay, I'm depressed. What is my goal? I want to be happy. Okay. How will you know when the problem is resolved? How will you know when you're happy? Physically, I'll have more energy and maybe lose some weight. Affectively, I won't feel as hopeless and helpless, and I won't dread getting out of bed every day. Cognitively, I won't be so foggy headed all the time. I'll be able to concentrate and actually get my work done. And relationally, I'll enjoy spending time with my friends, and I'll be more patient instead of just wanting to stay by myself under the covers and binging on Netflix. Okay. So those are all very observable goals, very observable endpoints that I can look at and say, yes, I've achieved it, or no, I haven't. For you, identify your goal and the physical, affective, cognitive, and relational clues that you have achieved that goal. So if it is being happier, if it is getting sober, if it is, something even more specific like getting improved sleep or improving your relationship with a particular person, whatever it is, identify a goal and identify the clues that you can look at, the things that you can look at to say, yes, I've achieved that goal. The next thing that comes with specific is what we do. And I was taught this by an auditor many, many years ago, and it stuck with me forever. The first thing that we need to do is learn about the overall problem, whether it's depression or addiction or relationship issues. That is a vast quantity of information. We need to learn about, for example, addiction in general. What causes it, what treatments are available, yada, 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 what symptoms people have. Okay, once you learn about addiction in general, it's important to remember that you are not in general. You are a very specific person. And the way that you experience depression or addiction or relationship issues is going to be different than the way anybody else may experience them or the symptoms that they have. There are going to be slight changes. So it's important to learn about your symptoms, causes, and triggers for the problem. For example, depression, if in the Diagnostic and Statistical Manual, our diagnostic manual, there are a bunch of symptoms that you can have, but you only need to have 5 in order to qualify for a diagnosis of major depression. Well, not everybody is going to have the same 5 symptoms. You need to know what your symptoms are and what your causes and triggers for that problem are. And then you need to go back to the stuff that you've already done in prior groups or in prior videos and look at ways that you have addressed those symptoms in the past. So you're learning about the overall problem. You're learning about what the problem looks like for you. Then you're identifying ways that you can address those problems, those symptoms. And then you're going to pick one way to address each of your specific symptoms, such as feelings of helplessness. What is one thing that you can start doing to address that? If you have difficulty concentrating, what is one thing that you can do to start addressing that? So going back to the goal that you identified on the last slide, describe the general and specific things that you need to learn and the skills that you may need to develop in order to address the problem. The next part is measurable. In order to figure out if you've done something, you need to be able to measure it. When you put water into the microwave, it's cold. When it comes out, it's hot. How do you know it's increased by so many degrees? You can put a thermometer into it, or you can say, it's going to be hot to the touch. That's kind of warm to the touch is how we do baby bottles. We don't actually measure their temperature. So there are a lot of different ways that you can measure something, but you need to be able to observe changes. You can look at the number of times per week, for example. If you are depressed, you can look at how many times per day are you crying. If you are using alcohol, look at how many drinks you consume in an hour. If you're having difficulty sleeping, how many times do you wake up per night? Or if you're planning on going to support group meetings, you can look at something positive, like how many meetings do you go to in a particular day? I know for some people in early recovery, they may go to 2 or 3 meetings a day and then gradually wean down to 1 meeting a day for a while. Another thing you can look at is duration. How long were you crying? Did you get tearful for a minute? Or were you crying for an hour? When we're dealing with grief, a lot of times this is one of the things that we look at. Initially, we may cry multiple times a day for extended periods. And then as we get away from that loss, we move further in time away from that loss, we may still have episodes where we get tearful, but they don't last as long and they may not be nearly as intense. You can do the same thing with binging or sleeping. How long did this go on for? For sleeping, you may want to look at increasing how much time you're sleeping. If you're sleeping too much, you may want to decrease it, but you can look at how long. And finally, you can measure goals in terms of intensity. How bad was it? How bad was your depression on a scale of 1 to 5? Or how happy were you on a scale of 1 to 5? How intense was your anger on a scale of 1 to 5? You want to give yourself something to measure by. That way you can see gradual improvements in whatever behavior you're trying to change. So using that goal that you identified a couple slides ago, identify how you plan to measure your progress. What are you going to evaluate every day to keep track of whether you're making forward progress or whether you're stuck? The next part is to make sure that it is achievable, relevant, and time limited. And those are the ART out of the SMART. And we're just going to talk about all of those at once. Rome was not built in a day. So don't expect yourself to change something you've been doing for 3 years in 3 weeks. Don't expect yourself to do something that is not doable. Sometimes people go on a diet and they want to lose um, 20 pounds in 2 weeks, and it is not physiologically possible for the majority of people out there to lose 20 pounds of fat in 2 weeks, or to lose 20 pounds in 2 weeks healthfully. So think about what is achievable. What can I realistically do and maintain? The best goals are built on prior strengths and individualized. So look at what has worked for you in the past and do more of that. Instead of trying to reinvent the wheel, build on what works for you. Make sure you're focusing on things that you are motivated and able to change. Some things you can't change. I have brown eyes. I can't change that. Um, if, people in your life are causing you distress, you can change how you react to them, but you can't change other people. Other people have to change themselves. So make sure that you are focusing on what you can change. Set small time limited goals. Start out on an hour by hour basis. For example, I didn't use in the past hour. All right, let's go through the next hour. You don't have to look towards forever or even towards all day. Let's just start with small steps. You get through an hour you haven't used, you can go, well, score. I didn't use. Let's see if I can do it for another hour. And then start saying, let me see if I can go all morning or all evening or even all day. Once you're regularly doing that, then say, okay, this week. Because when you look at it, if you go hour to hour, those hours add up. And eventually all those hours will have added up to a whole day. And you'll look back and go, hey, I made it an entire day. Good for me. Think of behavior change like learning lines for a play. You wouldn't expect people to read a script once and know it. You have to rehearse. You need to do things every single day. And just like actors, you are often going to need prompts or assistance to remember your lines, to remember what to do. As you learn, as your new behaviors become more routine for you, you're not going to need as many prompts. You're not going to need as many people to remind you, don't forget you got to go to a meeting. Don't forget to go to counseling. Don't forget to do this. You're going to remember it because it's going to be part of your routine. Thinking back to that goal that you set at the beginning of this video, what's the first thing that you're going to do to start making it happen? So maybe you want to get clean. Okay, well, that's great. That is the first step to getting sober. So you need to get clean, which means maybe you're not going to go to detox, which, make sure that you're being safe about how you're getting clean. Maybe you decide, hey, I want to get clean. So in order to do that, I'm going to start going to support group meetings, and I'm going to go to 90 meetings in 90 days because that'll help me not use. Okay, great. When will this start? Today. Okay, so I'm going to get clean by going to 90 meetings in 90 days, which will give me the motivation and encouragement I need to not use. I'm going to start doing that today. And at the end of 90 days, I will be clean because I will have not used for that period of time. Very simple. Well, simple to plan out, very hard to do, but you can do it. Pitfalls when setting goals. Some people fail to consider why they currently do or don't engage in this current behaviors. Why is it that you don't go to meetings now? Why is it that you use now? And how can you address that issue? If you use in order to self-medicate depression, you're going to have to figure out a different way to address that depression. You may set goals that are too big, set goals that are too hard, set too many goals at once. Keep your focus. Only set between 1 and 3 goals. Make sure there's sufficient rewards for your goals. And don't set goals that are too specific. If you set a goal that, I want to run a marathon in 3 hours, 47 minutes, and 26 seconds. That's too specific. Give yourself, say, I want to run a marathon in under 5 hours or something. So you have a little bit of leeway. And make sure that you individualize your goals based on your strengths and abilities.